You're listening to a Raconteur Studios podcast.
Hello and welcome to the After Hours Skin Clinic. I'm Dr Emma Craythorne, consultant dermatologist, and this episode is a little bit different. I'm joined today by Jessica, and you'll remember her from a previous episode where she's campaigning to axe the SPF tax. Well, she's back again today, but this time she has some questions for me. Hi Jessica, nice to see you again.
I'm back, and this time you're in the hot seat.
Hit me with it.
Okay, so this is something that really fascinates me, the science behind a suntan. So can you explain the science behind tanning and whether there's ever really such thing as a quote-unquote healthy tan?
Sure. So within our body, we have our skin layer, and at the very bottom part of the epidermis lives our melanocytes. And these melanocytes are responsible for making melanin. And melanin is essentially what gives us our skin colour. Now, some people make a type of melanin called eumelanin, and some people make a type of melanin called pheomelanin. Now, pheomelanin is typically made more by people who have red hair, green eyes, and that melanin is more of a reddy brown melanin, whereas somebody who makes eumelanin makes more of a browny black kind of a melanin. Now, the job of melanin itself is to protect the keratinocytes, so the skin cells, from damage from ultraviolet radiation. So there's a certain baseline level of that melanin in our skin. But if we expose ourselves to ultraviolet radiation, what happens is the ultraviolet radiation comes in directly. It goes into the melanocyte nucleus and switches on the production of melanin. So more melanin is made. It extends out from the melanocytes, which are a bit like big octopus cells, and it goes out along their long legs and then sits itself on top of all of the other keratinocytes. It's almost like the keratinocyte nucleus is wearing a little cap of melanin to protect it from more ultraviolet damage. So the real reason of why you get a tan is actually because you've already had a little bit of DNA damage. So the more you actively tan, the more you're getting damage and the more your melanocytes are trying to respond to protect you. So there is no such thing as a safe tan. There are certain types of tan that are worse than others, and that's certainly whenever you've then allowed yourself to go very red and then some people blister, but you turn red and then you turn brown. So turning red is much worse than just turning brown.
So would you go as far to say that a suntan is effectively your skin's trauma response to UV damage?
It's exactly what it is, yeah.
And why is that glamorized, do you think, in this day and age?
So it used to not be glamorized at all because there was a time where, you know, if you had a tan, that reflected that you were somebody who was an outdoor worker and you were working in the fields, and having a tan was something that wasn't a very desirable thing to have. And then what happened is our focus kind of started to change a little bit because a tan then started to represent a bit of social mobility, and you could travel on nice holidays and you had a bit of free time. You weren't working all the time. And so a tan then became a desirable thing to have. But it's really quite interesting because if you look at the world globally, a lot of people who have brown skin, they really don't want their skin to become browner because they often get bits of irregular pigmentation because of that. But also the idea of having your skin paler is more desirable. Whereas people who have white skin, the desire is to have your skin more brown and have this kind of luxury element of a tan. And then there's certain kind of social groups that place much more importance on the idea of having a tan. And, you know, you're a more desirable person if you have your tan. So I don't know why. Hopefully it will start to revert back a little bit to the pale and interesting times of Victorians. Although we did do a podcast on that subject, and that was also not helpful for your body because they used to do things like eat arsenic wafers and lie in arsenic baths to try and get as pale as possible. So, I mean, let's just stick with our own skin colour and not change it.
Yeah, hear. It's so interesting to hear your perspective on that and your knowledge as well, that it's having a suntan, even this day and age, is sort of a legacy, socio-economic, status affiliated thing, right? Even though it's bears no relevance to modern lifestyles. Okay, next question for you is, what is the craziest sun safety or sunscreen myth that you have seen spreading on social media?
I mean, I think the craziest sunscreen myth I see on social media is really the claim that SPFs themselves are causing skin cancer. It's completely wrong. SPFs do not cause skin cancer. In fact, SPFs, we know, protect you from getting skin cancer. And it's all to do then really with people saying that the chemicals in SPFs are toxic and they get absorbed into your body and you'll find them in your brain. And all of these statements I've just made in the previous 30 seconds are incorrect. They're not true. Everything has an element of toxicity to it, even water, salt, caffeine. But it's the dose that we expose ourselves to it decides whether that's going to be harmful or problematic to us as humans. And these formulations of SPF that we use are tested to the nth degree. They are not toxic. We are not absorbing them. They're not spreading around our body. They're not causing us problems in that sense. And we do know that for people who spend time outside, particularly, who do a lot of sports, who enjoy being the healthiness of being outside. I'm a dermatologist. I love being outside. I love being on the beach. I love walking. I love sports. I do all of these things outside. But I want to keep doing those things. And having Irish skin like mine, I would burn in about 20 minutes. And so I want to use sunscreens to make sure that I can continue to do those other really, really healthy things. So it does frustrate me, that element of it. And I kind of think, why are you saying this? Like, why are you telling people that this is going to harm them when actually the advice you're giving is going to harm them?
Yeah, of all the evils in the world, somebody decided, let's go after sunscreen.
Right.
Makes absolutely zero sense.
I mean, there's a whole lot further people up that chain of who I want to take down before
You'd like
we're
to
going
think
to get
so.
the sunscreen.
So I am really curious to know, how many skin cancers do you see in your clinic every week? And what would you say is their primary cause?
So I am slightly biased as a dermatologist here, okay? Because my entire kind of career in dermatology has been focused around the damage that the sun causes to the skin. And whether that is certain kind of skin aging diseases or whether it's skin cancers. And I work with a particular skin disease group called xeroderma pigmentosum, where people get skin cancers at a very early age. So I am, quite skewed in the kind of patients that I would see. But in a typical week, and I do Mohs surgery, I would maybe have 6 patients a day on my Mohs surgery list. If I'm seeing a clinic of perhaps 20 patients, probably around about 8 to 10 of them would be skin cancer patients or recurrence from skin cancer patients. And then there's some clinics that I do that are just not skin cancer focused at all, and I don't see any in those clinics. But it's probably around about maybe 15, 20 patients a week, something like that.
It just sounds relentless.
It is relentless.
And must be so frustrating for you as somebody who does this, as specialises in it, to hear misinformation, as we spoke about before, and also hear carefree attitudes towards SPF and sun safety.
And actually, because being a Mohs surgeon, typically we just do Mohs surgery on the head and neck. So again, my patients and even my skin cancer patients essentially are all skewed towards head and neck lesions. And as you say, okay, a basal cell carcinoma, which is the type of skin cancer that you had, that's not going to go anywhere. It's not going to spread anywhere, and it's not going to cause problems anywhere else in your body. You're pretty safe if you've got a BCC in terms of it's not going to kill you. However, the best way to remove it is by cutting it out. And to have something cut out on your face, particularly whenever it's in an area of function, so near the eyes, the nose, the ears, and particularly if it's not been maybe removed properly the first time, so it's got bigger, or it's been neglected because people haven't thought it's a skin cancer and it's much bigger than what you expect. That process is really difficult for somebody to have to go through. And, having any kind of surgery on your face can be quite difficult. And particularly if it's then become a big skin cancer as a consequence, because it has to be cut out, and then people's faces are different. So I do think that often when people are relentlessly talking about the dangers of SPF. It's so frustrating whenever I see what's happening in my clinic where SPF is so helpful and so preventative of most of the skin cancers that we would see.
Yeah. We keep coming back to this topic of misinformation in our conversations, and it's great to have somebody who is an advocate and so prominent on their platforms and using their platforms to actually dispel those sunscreen myths and sun safety myths. For every bit of misinformation out there, thankfully, there are dermatologists out there dispelling it. So thank you for all the work that you do. Now, I have one more question for you, and this one's a fun one.
Oh, good.
As a dermatologist, if you could take the reins in Downing Street for a day, what policies would you implement to improve Britain's skin?
Isn't that a great question? Oh my, let me get my iron rod out.
Iron Lady Mark II, I love it.
Well, I would very much support your SPF tax axing, because I agree with you, this is not a luxury item. This is a basic piece of healthcare. So I would say that would be one of the things I would do. But really, the nation's skin health, that's a huge topic. And one of the things that I would do would be to have more dermatologists. The wait time now to see a dermatologist for a non-urgent condition is probably around about 2 years in most parts of the country.
Oh, wow, I had no idea.
Yeah. So in many places in London, we're slightly privileged. There's more dermatologists around. But for other parts of the country, it can be around about a 2-year wait. So it's a really long time. In addition to that, you do have then this huge tsunami, really, of skin cancer cases that need to be seen. And being able to see those patients in a really quick and effective way, that process just needs, streamlined. And most of that would come from having more attention and more dermatologists. So I would say that would be my top thing to do, and triaging these patients so they are getting to be seen more quickly, but by dermatologists, because often they'll be seen by other people and it just delays time. And with the best will in the world, people are trying to do the right thing for that patient in front of them. But as a dermatologist, you're able to get to the answer quickly. You can see a patient, get the answer quickly, get the right treatment quickly. So I would say just more access to dermatology. Would be my number one thing. And then your SPF tax is number 2.
And just on that, I'm really curious, what factors have been, the architects of that dermatologist shortage?
Well, traditionally, dermatology has not really been thought of as a branch of medicine that was ever really at the forefront of people's worries or concerns. So heart obviously is right up there, the lungs are right up there, and all of these tend to get a lot more attention than dermatology would do. And even in large hospitals, despite the fact that we all have these dermatology conditions, everyone will have a dermatology condition right now or know somebody with it. Everyone. That's just what it is. But it doesn't get that same attention, doesn't get that same level of funding, and doesn't have that same presence within hospital scenarios and kind of government influencing positions.
It's fascinating, isn't it? Skin's the largest organ of the body, and yet it's often, an afterthought for so many people.
Exactly. And whenever you think it's more than just the health of the skin, because it's a visible organ. And so many of the things that will stop a person from functioning as best they can are things like, how do you ask somebody on a date? How do you speak to your boss? How do you do a presentation? All of these different things. And if your skin isn't behaving, it might not be hurting, it might not have other problems associated with it, but if it looks really, really different, then often that has issues alongside it as well.
Well, that's really fascinating. Thank you so much for answering my questions.
Thank you for bringing the questions.
You are officially off the hook, and I look forward to seeing you in Downing Street.
Yeah, we can do this together, I reckon.
Would love that. I'll be your health sec any day.
Exactly. Okay, that's bye for now, my lovely listener. Remember, Jessica's campaign is Axe the SPF Tax, and we talked about that more in a previous episode, so you can have a listen to that too. Take care of yourself and your skin. Wear your SPF, and I'll see you next time on the After Hours Skin Clinic. As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.